views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and as always, we encourage you to continue participating in the program by dialing 718-960-7261 with any questions you may have. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. You can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing orthopedic conditions related to the hand, wrist, and fingers.
Joining us this evening is Dr. Philip Findling, an orthopedic specialist with extensive experience in the treatment of the hand, wrist, and finger injuries and problems. Welcome.
Now, before we hear from you, Dr. Finley, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261. And please call us. Now, Dr. Finley, let me start by asking you to describe for our viewers the overview of the services that you provide in terms of the hand, the wrist, and the fingers.
Sure. So anything that happens from the fingertips to the elbow is something that I could help treat. So whether you have a cut on the nail that requires stitches, or you fall down and your finger is swollen, you can't move it, maybe you think it's broken. If your hands get numb and tingly and you can't feel the tips of the fingers, your elbow is sore every time you pick something up. Literally anything that happens, any injury, any complaints that you have from the tip of your finger to your elbow is something that I could help with.
Okay, that's good to know.
Yeah. As a surgeon, I'm especially interested in the various types of surgery you perform, from the simple to the complex. Go in the middle.
The interesting thing about hand surgery as a field is that there's such a variety of surgical procedures that we can perform to help you regain your function. So sometimes when you break your arm, you break your wrist, you break your fingers, that requires an operation. Maybe you need a plate and some screws, or maybe you just need it to be set back in place and put on a cast. If you have loss of sensation, sometimes you require an operation on your nerves. You can't move your fingers and the tendons are injured, that requires repair. If you break a glass in your hand and you cut the nerves to the fingers, all of those things require surgery.
Yeah. Could you give me a sort of length for different things? Just a few, maybe one or two.
In terms of
How long, operative, yes.
Okay, so something like carpal tunnel syndrome is a very short operation. It takes about 15 minutes. Something like a wrist fracture, which requires hardware in the sense of plate and screws, that could take up to an hour and a half or 2 hours. Multiple tendon injuries, tendons are what bend our fingers and straighten our fingers, that could be up to 3 hours of surgery. Nerve surgery also, especially if it's microscopic surgery, which is something we do as well.
Right.
Okay.
Now, as the summer season is approaching, there are certainly many more sporting activities that will take place. And obviously, there's greater potential for injuries as well. What are some of the more common injuries that occur related to sports as well as even the summer season itself?
So once the pools open up, there are a lot of slip and fall injuries. And slip and falls onto the hand and wrist tend to end up with something broken, whether it's a finger, a hand, a wrist, an elbow. And very many times these require surgery, although occasionally they can be treated non-operatively. Baseball is a popular summer sport, and sliding into a bag hand first can cause ligament injuries in the thumb or fingertips, which would also require intervention, either casting or surgery as well. Any water sport can really
Cause problems.
sure, and you know, there's
Slippage and stuff.
And I guess on the other side of the spectrum, the winter, slipping on the ice might create problems as well.
So there's no shortage of injuries in either the summer or the winter, and I don't know that one specifically is a higher incidence than other. I mean, it's very easy to injure yourself. You'd be surprised at how little it takes.
One of my friends asked the next question, so I'm asking it for him. Can you define carpal tunnel syndrome for the viewers and him?
Sure.
From the perspective of causes and treatment, length of stay after repair.
Carpal tunnel syndrome is one of the most common problems that can occur in the hand, and in its simplest terms, carpal tunnel syndrome is a pinched nerve. And just like you could have pinched nerves in your neck or your back, I'm sure everyone has heard of that, you can also have a pinched nerve in your wrist. And this nerve, when it gets pinched, causes symptoms that are quite uncomfortable: numbness, tingling, pins and needles. These symptoms are typically worse at night, in the evening times. Very often people will wake up in the middle of the night with their hand sleeping, and they'll think they just slept on it wrong, whereas in actuality, they have a pinched nerve. There's a reason the symptoms are worse at night, and that has to do with the physiology of how we sleep, and I don't want to be too complex about it, but typically the symptoms are worse at night, and in order to help alleviate that, we try splinting the wrists at night so that we don't bend them too much. Okay. In terms of other treatment options,
How long the surgery?
Surgery is very common, unfortunately, although it is a minor surgical procedure. The actual surgery itself takes about 15 minutes. It's same-day surgery, so you get to sleep in your own bed at night, and very often patients have relief that same night of surgery. Very mild pain, Tylenol or Advil is more than enough to help with the pain. You wear a small bandage on the hand for about 2 weeks, and you're back to your normal activities very shortly after that.
Recurrence?
There should be no recurrence with carpal tunnel syndrome, although in medicine there are always a few exceptions. But when treated appropriately with surgery, there should be no recurrence.
Okay. Now moving to the subject of arthritis, just how does it impact the hand, the wrist, and the fingers? And for that matter, the elbow as well, I guess.
So as we all know, if we've ever had a little stiffness in our hand or difficulty using it, pain, it's present all the time. Arthritis is typically worse in the morning after prolonged periods of inactivity. It's an aching, pain. It makes things difficult to do throughout the day, and it's very, very common. Arthritis, especially at the base of the thumb, is one of the most common places in the body to develop arthritis. So we're talking about this joint here. And
Injection?
Well, we could do an injection, but over 40 million people in the United States alone have arthritis at the base of their thumbs. There are various different options for treatment. Injection is one of them, although we like to save that towards the end. Splinting is very helpful to immobilize the joint. Oral anti-inflammatory drugs, they're called NSAIDs or non-steroidal anti-inflammatories, are helpful. There are topical anti-inflammatories, which is like a gel that you could rub on. They help with pain relief as well as inflammation. Injection, of course, a steroid injection. And there's even a joint replacement for the thumb, similar, although different, to knee replacements or hip replacements. The joint replacements for the thumb don't actually require any foreign bodies, any metal implants or anything.
Okay, I don't have arthritis. What recommendation do you give me to prevent the occurrence of arthritic pain?
Well, certain types of arthritis...
It's a question that's asked, but I didn't want to put you on it. But
well, they can be delayed with things like calcium supplements or glucosamine supplements. However, our joints are not meant to last forever, and everyone has different genetic makeup, and so everyone's body does break down at different rates. And so if we all lived long enough, everyone would develop arthritis in some joint of their body.
Right. And we need surgery.
Now you mentioned surgery. What percentage would you say do you perform surgeries versus just treatment?
So although I'm a hand surgeon and I love operating, less than 15% of the patients I see in the office require surgery. The majority of things can be treated non-operatively, although there is occasional pain in the form of injections, but for the most part, surgery is the last resort.
So that's good news for our viewers.
Good news for everyone.
Right. Now, in terms of the gels that you mentioned before, or even the over-the-counter creams, what is your opinion of their effectiveness and when should they be used? The ones that you hear advertised all over the place.
So there's varying degrees of effectiveness, and certainly everyone feels relief differently. There's absolutely nothing wrong with trying those first. There's very little downside,
Right.
and there's the potential for having significant results. And there certainly are prescription ones as well, instead of over-the-counter ones, that may work even a little bit better. But they're definitely something I recommend trying instead of having to take a pill every day.
How long?
Well, as with anything,
Yeah.
you give it a week or 2 weeks, and if you're not having any relief, you know, then you're banging your head against the wall, and let's try something else.
That's a good
Okay,
answer.
on that note, let's pause for a short break, and when we return, we will continue our discussion as well as take calls from you, our viewers. Once again, the number to call is 718-960-7261. That's 718-960-7261, and please call us.
During this, our year of women's health, we take pride in the extraordinary success of our women's health programs. And when it comes to caring, our OBGYN team is second to none.
At Bronx Lebanon's Women's Health Center, its labor and delivery unit, and Center for Gynecological Care, services are provided in a welcoming environment.
Women in the Bronx can always depend on our OBGYN team for expert, compassionate, and highly specialized care. We deliver the best in women's health services.
Bronx Lebanon's intensive care unit is providing treatment for pregnancy and gynecological-related conditions.
We work with our multidisciplinary team to stabilize our patients. Following discharge, we refer them for outpatient care at our Health and Wellness Center.
Winning the battle against breast cancer represents another crucial challenge.
At our Breast Cancer Center, we've implemented a comprehensive approach that involves exam, imaging, and biopsy, which is clearly succeeding in the detection of early cancer.
Significant progress is also being made in the treatment of colon cancer.
Today, I will be performing an endoscopy. Our goal is to prevent cancer. By performing endoscopy and colonoscopy, we are identifying lesions which can be treated at the time of the procedure or referred for surgery.
When illness occurs, Bronx Lebanon's nurses are providing excellent and compassionate care.
We pride ourselves in understanding the physical and emotional needs of our female patients, closely monitoring their well-being and preparing them for the miracle of childbirth.
In the ER, we see some of the most dramatic examples of the Bronx Lebanon team in action.
A high percentage of the patients seen in the emergency department are women, and we are sensitive to their needs. But what is also important is that our ER is helping patients overcome all types of emergency situations.
And keeping its female and male patients moving in the right direction is Bronx Lebanon's Department of Orthopedics.
Our programs are among the best in the nation in treating bone and joint problems, including hip, knee, and shoulder replacements, as well as spine, hand, and foot surgery.
The Department of Family Medicine is another Bronx Lebanon success story.
The close relationship we have developed with women and their families has become the driving force in our efforts to provide comprehensive primary care to the community.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, ear, nose, and throat, men's health, neurology, ophthalmology, pathology, pediatrics, psychiatry, radiology, medical education, and long-term care, as well as through its Bronx Care Outpatient Network, and with the completion of its Health and Wellness Center for Ambulatory Care, Life Recovery Center for Chemical Dependency, and selection as a New York State Performing Provider System lead, Bronx Lebanon is positioned for continued success.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261 with any questions you may have. and we will certainly do our best to answer them. That's 718-960-7261. Now, before we continue our discussion, I understand we have a caller. Derek, I believe, is on the phone.
Derek, you have a question for us?
Did we lose Derek?
Derek?
Yes, so I'm here. My question is regarding some daily activity that probably goes underlooked that would that would result in wrist injury, and the ways in which we can go about those daily activities to limit the risk of injury or severe, I guess, pain from common wrist functionality and or activity that would result in injury.
Did you get a question?
Yes.
Good, yes.
So thank you for the question. Thanks for calling in.
This is a hard question.
I thought I was going to get easy ones.
Yeah.
Okay. So some common injuries to the wrist are ligament injuries, especially, and this can be from simple activities like lifting ourselves up from a chair or from a table. Whenever we bend the wrist backwards or extend or hyperextend, we put one of the major ligaments of our wrist in jeopardy. This is called the scapholunate ligament. And so by simply keeping our wrist straight when pushing up from a chair or a table instead of hyperextending it, that can help prevent this sort of injury. Another sort of common injury is twisting the wrist too hard. That can cause a ligament injury as well. And so we should be careful with the amount of force we use to do things like either turning a screwdriver or opening a stuck door. Yeah, well, even a can of something, absolutely.
Yeah.
Okay.
Right. Thank you very much. Nice call.
Now, on that note, a question that we often ask our panelists is to share their respective backgrounds with our viewers. And I'm sure your background is quite interesting. Perhaps you can share with our viewers the academic aspect to it, as well as also what led you to choose a career in orthopedics itself.
Sure. So I grew up about an hour and a half north of here in a small town, and my whole life I was always interested in medicine. I went to undergraduate in Boston and then medical school back here in New York, along with all of my training here in Brooklyn and Manhattan. Orthopedics, and specifically hand surgery, I found very, very interesting as a subspecialty, as I got to do a little bit of everything. Microvascular surgery.
You can continue this, but
Louise
have a call. Louise, you have a question? Louise?
Louise.
Louise.
Louise, you're on the air.
Yes, I have a question in regard to tennis and or golf elbow. Does that have any impact on the wrist?
Okay, good question. Yes, so tennis elbow or golfer's elbow, what we're talking about here briefly is pain either on the outside of the elbow, which would be tennis elbow, or the inside of the elbow, which would be golfer's elbow. And absolutely, it's related to the wrist. So these common terms are describing an inflammation of the tendons in the elbow.
And how do you treat that?
So the reason these can cause wrist problems is because these tendons extend all the way from the elbow down to the wrist, through the wrist and into the fingers. So any activity at the wrist can cause strain on the elbow. Treatment options for tennis elbow and golfer's elbow, as we like to call them, include, again, oral anti-inflammatories, resting, bracing, either the wrist or the elbow. Therapy plays a very important part in terms of strengthening. Injections of steroids are useful as well. And occasionally, but rarely, they do require surgery. Less than 5% of people require an operation for these specific conditions, and they're generally treated very well conservatively.
Okay.
Okay,
thank
now,
you
you
very
had mentioned
much.
earlier your career choice. Perhaps you can finish your response.
Sure. So hand surgery provides me the opportunity to have some variety, as well as a very detail-oriented level of operative procedures. So I can fix a wrist fracture, which is a little bit less delicate, and then the very next case be repairing a nerve so small that I need a microscope bigger than any of the equipment in this room to repair it. And using suture material that's thinner than a human hair. And so it provides a very diverse set of skills required, as well as a diverse knowledge base, and I find the field very fascinating.
Okay, thank you.
You're telling us all of these operations. I want to know if they recover. Now, let's discuss the recovery process from the perspective of the surgeries that you perform and including the recommended course for rehabilitation. Just tell us a little of that.
Sure. So obviously every operation requires different recovery times. Something small like a carpal tunnel or even a tennis elbow is typically 2 weeks in a splint for immobilization.
We're going to have another call. We're interrupting you once again. Maria's on the line. Maria?
Hello, yes.
You have a question for us?
Yes, good evening. I know that we're speaking in regards to hand injuries, but I wanted to know in regards to preventing injuries in the fingers, what is the most efficient disinfectant? I know that people talk about antibacterial soap, but is it efficient in getting rid of bacteria that's under the fingernails?
Good question.
Excellent question. So the truth is that washing your hands appropriately for the appropriate length of time is the most effective thing you can do to prevent bacteria from building up, especially under your nails, which is a very problem area, or in between the fingers as well. Those areas tend to be overlooked, and we do a quick little scrub, and we don't spend enough time cleaning. Antibacterial soaps can be helpful, but are not necessary. As long as you clean for the appropriate length of time and pay attention to the tips of the fingers and in between the fingers themselves, then you should have no problem keeping germs away.
Would hand sanitizer be a better
Now, another question we asked.
Wait a minute, no, what about the hand sanitizer?
I'm sorry, can you repeat that?
I'm sorry, is hand sanitizer a better alternative?
Hand sanitizer is good when used in moderation, but it cannot replace effective hand washing with soap and water. So 2 or 3 times with hand sanitizer, and then you should wash your hands clean with soap and water.
Okay. Now, another question, moving from that question, another question that we ask our panelists is to share their patient success stories with our viewers. And just by the sound of your discussion tonight, it sounds like you've had many. Can you share some representative examples with us?
Sure. So very difficult injuries to recover from are hand and wrist fractures. And people are in tremendous pain, and they just cannot see the light at the end of the tunnel. But an operation for these, as opposed to casting or splinting, does very, very well in terms of increasing the time for recovery and making you feel better quicker. So surgery and then 2 weeks of immobilization, and you start moving your wrist already, as opposed to putting on a cast for 6 weeks and losing function for a long time. However, I think the patients with the most success, the happiest patients, are the patients with carpal tunnel syndrome. They get relief the same night of surgery. They come in thanking me. They are so happy, so grateful that they are no longer waking up in the middle of the night. They've regained function of their hands. Their numbness and tingling, their pain is gone. They're one of the best.
Good. All right, Dr.
Okay,
Pierce.
we know that most arthritic problems advance during the aging period. Can you describe some of the more common problems?
Sure. So arthritis in the fingers and wrist is relatively common. As we discussed earlier, the base of the thumbs are probably the most common place in the hand to develop arthritis. But you can also develop arthritis in the tips of the fingers or across the knuckles here. And again, treatment options are variable. There are joint replacements even for the knuckles, these 2 sets of knuckles, although the very end ones we haven't quite managed.
How successful are the results?
So when done for the appropriate indications, the results are tremendous, especially for the base of the thumb. The operation is very, very successful, and people are very, very happy with that.
Okay, now for our potential patients out there, how can they gain access to your services? Is there an appointment necessary? Can they walk in? Where are you located as well?
So I practice at the main hospital, Bronx, Lebanon. I'm Grand Concourse. And yes, majority of things, an appointment is probably better, but I very rarely turn anyone away. So if you show up in my office and you tell me your hand hurts, I'll fit you in that day, even if it means everyone stays late. We like to take care of everyone.
Okay, great.
So that's good. When are prescription medicines necessary, and how effective are they for arthritic conditions?
So
you sort of mentioned it before, but maybe everybody has a little arthritis, and what are the beginning?
The truth is there are very, very effective non-prescription anti-inflammatories. And
like what?
Like Aleve, ibuprofen, Advil, Motrin. All of these medications are anti-inflammatory, so they take away the inflammation, and they also help with pain relief. Should they be ineffective, if you're not having relief with them, then we could always try a prescription medication. Typically, the prescription medications are designed to be taken for a longer period of time and have less upsetting symptoms to the
Now,
stomach.
what about taking an aspirin daily, or even exercise and diet? Give us a quick answer.
Different
for that.
disease, right?
So, well, an aspirin daily is good for heart disease.
Right.
For pain, it's probably not the top choice. Right. Exercise, healthy exercise and diet are absolutely essential to maintaining good functioning joints and to maintaining your orthopedic health.
Okay, now in the time remaining, just give our viewers a re-review of the types of problems you encounter in your daily practice.
Absolutely. So,
as well as your recommendations.
I think anything that's bothering you, you should come see me. But hand pain, numbness, fractures, even if you think it's a minor sprain, it could be much more complicated than that. And there are a lot of things happening that we can't see under the skin. It takes a lot of different parts working together to make a fist. And if any one of them is out of function, then you're going to have a big problem going forward. So I advise get it checked. Better to be safe than sorry.
Okay, well, Dr. Findling, let me thank you for joining with Dr. Gums and myself on tonight's HealthBeat television program.
Thank you for having me.
And most importantly, let me thank you, our viewers, for tuning in this evening.
If any of you, our viewers, have questions or need assistance, I encourage you to call our physician referral service. That is by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxlab.org. Good night, and see you next week when we will be
discussing another important
healthcare problem.